Hey everyone, Dr. Sarah here, and I'm pumped to be teaming up with Professor Jay today to bring you some seriously valuable insights into the world of mental health. If you're a psych undergrad like me back in the day, you know how crucial it is to really understand the different therapeutic approaches out there. Today, we're diving deep into the fascinating world of therapy, focusing on treatments for anxiety and PTSD. These conditions can be incredibly tough to deal with, so we're going to break down some of the most effective methods used to help patients find relief and regain control of their lives. Let's kick things off with cognitive behavioral therapy, better known as CBT. This therapeutic approach has been a game changer in the field of mental health, offering a structured and effective way to tackle a variety of psychological issues. Whether you're dealing with anxiety, depression, PTSD, or even everyday stress, CBT provides tools and techniques that can make a significant difference in your mental well-being. This is like the gold standard for treating anxiety and PTSD, and for good reason. CBT is backed by a wealth of scientific research and has been proven to be highly effective. It's not just about talking through your problems, it's about actively working to change the way you think and behave. This dual approach can lead to lasting improvements in your mental health. Think of CBT as a dynamic duo of therapy techniques. On one hand, you have cognitive techniques that help you understand and reframe your thoughts. On the other hand, you have behavioral techniques that encourage you to change your actions. Together, these methods create a powerful synergy that can help you break free from negative cycles. On one side, we've got the cognitive part, which is all about identifying and challenging those negative thought patterns that can really drag us down. These are the automatic thoughts that pop into our heads without us even realizing it. They can be incredibly damaging, leading to feelings of worthlessness, anxiety, and depression. By learning to recognize these thoughts, we can start to challenge and change them. Those what-if spirals and self-critical thoughts that can pop up and hijack our peace of mind. These thoughts can be relentless, making it hard to focus on anything else. But CBT teaches us that we don't have to be at the mercy of these thoughts. We can take control and steer our minds in a more positive direction. Then we've got the behavioral aspect, which focuses on changing those not-so-helpful behaviors that might be keeping us stuck. This could be anything from avoiding social situations to procrastinating on important tasks. By changing these behaviors, we can start to see improvements in our mood and overall well-being. CBT is all about empowering patients to become their own thought detectives. It's about giving you the tools to investigate your own mind and uncover the patterns that are holding you back. Once you understand these patterns, you can start to change them. This process can be incredibly empowering, giving you a sense of control over your own mental health. We're talking about learning to recognize those distorted thinking patterns, challenging their validity, and ultimately replacing them with more balanced and realistic thoughts. This isn't about ignoring the negative or pretending everything is perfect. It's about finding a more balanced perspective that allows you to cope with life's challenges in a healthier way. It's not about sugarcoating things or pretending everything is perfect, but about developing a healthier and more adaptive way of thinking. By doing this, we can improve our mental health and overall quality of life. So, if you're struggling with negative thoughts or unhelpful behaviors, consider giving CBT a try. It might just be the key to unlocking a happier, healthier you. Now, let's talk about something super cool: virtual reality therapy, or VR therapy. This innovative approach is revolutionizing the way we address mental health issues, making therapy more accessible and engaging for many people. Imagine combining the immersive experience of virtual reality with the therapeutic techniques of a trained professional. It's like stepping into a whole new world where you can safely confront and overcome your fears. This is where technology meets therapy in a truly amazing way. By using VR, therapists can create realistic scenarios that help patients face their anxieties head-on. Whether it's a fear of flying, social anxiety, or even PTSD, VR therapy offers a unique and effective solution. Imagine this: you're struggling with PTSD after a car accident. The memories of the event are so vivid and distressing that they interfere with your daily life. Traditional therapy methods might not be enough to help you process these traumatic experiences. The thought of even getting behind the wheel again sends shivers down your spine. You avoid driving altogether, which limits your independence and affects your quality of life. This is where VR therapy can make a significant difference. That's where VR steps in. By using a VR headset, You can be gradually exposed to driving scenarios in a controlled and safe environment. The therapist can adjust the intensity of the experience based on your comfort level, helping you build confidence and reduce anxiety over time. With VR therapy, patients can confront their fears in a safe and controlled environment. This method allows for gradual exposure, which is a key component in overcoming phobias and anxiety disorders. The therapist is there to guide you through each step, providing support and encouragement. Picture yourself wearing a VR headset, immersed in a virtual world that's been carefully designed by therapists. This world can simulate various scenarios that trigger your anxiety, allowing you to face them without any real-world consequences. It's a powerful tool that can help you rewire your brain's response to fear. If you're afraid of heights, you might find yourself virtually standing on a balcony, gradually increasing the height as you become more comfortable. The virtual environment can be adjusted to match your progress, ensuring that you are always challenged but never overwhelmed. The beauty of VR therapy is that it allows patients to experience and manage their anxiety in a controlled setting. This controlled exposure helps desensitize the brain to the triggers of anxiety, making it easier to cope with these situations in real life. Over time, patients often find that their fears become more manageable and less debilitating. It's like dipping your toes into the water before taking the full plunge. By gradually increasing your exposure to the things that scare you, VR therapy helps you build resilience and confidence. This method has shown promising results for a variety of conditions, making it a valuable addition to traditional therapeutic approaches. Sometimes, anxiety and PTSD can feel so overwhelming that it can be hard to see a way out. The weight of these conditions can make even the simplest tasks feel insurmountable, leaving individuals feeling trapped and hopeless. In such cases, outpatient therapy alone isn't enough. While outpatient therapy provides valuable support, it may not offer the intensity or immediacy needed for those in acute distress. That's where inpatient treatment comes in. Inpatient treatment offers a higher level of care, providing a structured environment where individuals can receive the comprehensive support they need. This involves checking into a hospital or specialized facility, where a team of healthcare professionals is available around the clock to provide care and support. Here, you can receive around-the-clock care and support, ensuring that help is always available when you need it most. Now, inpatient treatment is typically reserved for more severe cases, where the level of care required exceeds what can be provided on an outpatient basis. This is often the case for individuals who might be at risk of harming themselves or others, or when their symptoms are significantly interfering with their daily life. When daily tasks become a struggle and distress becomes overwhelming, inpatient treatment can provide the necessary respite and intensive support. Think of inpatient treatment as a safe haven, a place where you can focus solely on your recovery without the distractions and stressors of everyday life. It's a place where you can immerse yourself in the healing process, surrounded by professionals dedicated to your well-being. In this structured environment, you can engage in individual therapy sessions, group therapy, and other therapeutic activities designed to support your recovery. It's a structured environment with individual therapy sessions, group therapy, medication management, and holistic therapies like art or music therapy. These holistic therapies, such as art or music therapy, can provide additional avenues for expression and healing, complementing traditional therapeutic approaches. Additionally, activities like physical exercise and mindfulness practices are often incorporated, helping to promote overall well-being and resilience. Inpatient treatment is about creating a comprehensive support system, tailored to meet the unique needs of each individual, fostering a path to recovery and a return to a more balanced life. Now let's talk about medications. It's important to remember that medication is just one piece of the puzzle when it comes to treating anxiety and PTSD. For many people, medications like SSRIs or selective serotonin reuptake inhibitors, or SNRIs, serotonin norepinephrine reuptake inhibitors, can be incredibly helpful in managing their symptoms. These medications work by balancing certain chemicals in the brain, like serotonin and norepinephrine, which play a role in mood regulation. In some cases, especially for short-term relief from severe anxiety, benzodiazepines might be prescribed. However, it's crucial to use these medications cautiously and under the guidance of a healthcare professional, as they can be habit-forming. Last but not least, let's talk about the power of group therapy. You know, there's something truly special about connecting with others who understand exactly what you're going through. Group therapy provides a safe and supportive space for individuals to share their experiences, learn from one another, and realize they're not alone in their struggles. It's like a weekly dose of empathy and encouragement. In group therapy, individuals can practice their coping skills, challenge each other's negative thoughts, and celebrate each other's victories. It's a powerful reminder that we're all in this together. That's a wrap for today, folks. We've covered some seriously important ground in the world of therapy for anxiety and PTSD. Remember, knowledge is power, and the more we understand about these conditions and the available treatments, the better equipped we are to help ourselves and others. If you found this video helpful, don't forget to give it a big thumbs up and hit that subscribe button for more awesome psychology content. And as always, stay curious, keep learning, and let's continue to break down the stigma surrounding mental health. Until next time, take care.